Hello, my name is Lucy Lemanowitz and I'm a senior in HHS454. And today I'll be talking about the research I gathered in the literature review for the clinical uses of ketamine. Ketamine itself is a water-soluble phencyclidine derivative, and this is a dissociative anesthetic that is used in both recreational and clinical settings. Mostly known, ketamine is used as a recreational drug or in veterinarian practices. But today, with new emerging research and clinical findings, different uses for ketamine have been found, and it is now being moved outside of the anesthetic realm into other usages, such as an antidepressant, an anti-inflammatory, and a drug that's used for pain management. Originally, in the 1970s, scientists and practitioners used ketamine as an anesthetic drug or a drug for analgesic purposes. But today it is being moved outside of that realm due to its unique chemical properties. It is an enantiomer that has both an L and an R enantiomer, and these two different forms are what helps it have such a wide variety of pharmacological effects. This drug can be used for sedation, catalepsy, somatic analgesia, bronchodilation, and sympathetic nerve system stimulation, amongst many other things. It is also being used to help treat mental health disorders such as PTSD, suicidal ideations, and depression. However, the clinical effects of the mental health disorders are still being studied, and the consequences of using this drug for that. There are a few potential risk factors for using ketamine, including a potential abuse factor, just because this drug can become addictive if used over long periods of time in large dosages. However, this can be alleviated by stopping the course of treatment and by the cessation of the drug. So the addictive tendency should go away with the cessation of the drug as well. Another long-term effect of using this drug is the increase in prevalence of post-operative nausea and vomiting, as well as the increase in the intensity of that post-operative nausea and vomiting. However, it is still being used along with these side effects because other drugs that do have anesthetic purposes also have these side effects. The old pharmacological properties of ketamine that were originally found in the 1970s to 1990s are now being combined with newly found beneficial clinical properties to give ketamine a new wide variety of usages. Like I said, it is now being explored as a piece of treatment for pain management, anti-depression treatment, and anti-inflammatory. I do say piece of the treatment because this drug is typically taken in adjunct to other drugs, as it is effective by itself, but most effective with other drugs when trying to treat something. Like for pain management, ketamine might be chosen today over opioids because opioids can cause a development of increased pain sensitivity and opioid tolerance. While this is something that practitioners are trying to avoid, the use of ketamine is able to bypass this, and with even just one dosage, people are finding they have faster and better results without developing that tolerance to the drug, which makes them need more. Including with treatment with major depressive disorder, this is something we see as well. When compared to antidepressants, one dosage of intravenous ketamine has been proven to show a rapid improvement in symptoms, including suicidal ideations, while antidepressants might take up to 3 months to build up in one's body enough to go ahead and start working on those symptoms. Its short-term effects, ketamine's short-term effects on major depressive disorder can last for 1 to 2 weeks after that initial dosage. However, the long-term effects are less reported on, and we still do need more research on that. There are plenty of other areas where ketamine does need more research on. One is the limitations and warnings not indicated for conditions such as hypertension, schizophrenia, and raised intraocular pressure. However, there is a lot of research done on the use of ketamine for eye procedures, but there is not a lot of evidence yet on the cost effectiveness of using ketamine for adult patients with painful and traumatic brain and eye injuries. Another form of research that we really need to start looking into is the use of ketamine in developing countries. Developing countries still use ketamine primarily as an anesthetic, while here in America, as we do use it as an anesthetic, we are looking forward to more and a wider variety of clinical treatments. One upside to the developing countries using ketamine so frequently for these anesthetic purposes, though, is that their practitioners are much more well versed in the drug and much more well prepared for administering this, as well as it being more prevalent and more readily available in their clinics and their hospitals as it is here. A lot of anesthesiologists and people who do administer the drug here in the US receive minimal training on how to do so, and also don't have a lot of knowledge about all of the other usages that have been coming out. Ketamine can be given several different ways. However, the primary way in most cases is intravenously. If the patient is obese or a child, typically intravenous is not the best route to give this drug due to potential side effects. It is not also always the most achievable route for emergencies. Additionally, the intramuscular route is associated with longer recovery time and does have a higher rate of vomiting when compared to the IV route. For both obese patients and pediatric patients, they will choose the IM route, the intramuscular route. Overall, when administering ketamine, a patient really must be observed. So the best practice for this drug is to be given in an outpatient center where they can be observed for their blood pressure, their heart rate, changes in their respiratory rate, oxygen saturation. They also must have changes be observed for changes in their behavior, such as increased agitation, hallucinations, dreams, and depersonalization. However, moving forward in the future, I do believe that this drug is extremely effective in treating the things that they have already found, and that it has many untapped possibilities for treating other physical and mental ailments. The use of this drug is relatively new to the clinical setting, but with more research, more education, and more usage, and just people getting more comfortable with it, I do believe that we can open many new doors in the future to possible usages that have not even been thought of yet. Thank you.